answers to some of the questions if members are agreeable. But agreed? Agreed. So welcome the Minister and to make your opening remarks.
Thank you very much, Kieran. And I want to thank the members of the committee for the invitation to speak to you today regarding the crucial issue of standards of care in nursing homes and the oversight of these matters. I'm joined today by Ms Siobhan McArdle, Assistant Secretary in the Social Care, Mental Health, Drugs Policy and Unscheduled Care Division in the Department of Health, beside me to my right. And I'm also joined by Principal Officer Trevor Moore to my left and Principal Officer Ms Laura Casey to my right. To begin, I want to acknowledge the RT Investigates programme that was broadcast on the 4th of June. I want to commend them on this very important piece of work. This hard-hitting and harrowing programme highlighted a litany of poor care standards in 2 nursing homes showing clear neglect and abuse of older people, namely the residents in Portlaoise and Bennevin Manor and Glasnevin. The welfare of both the residents and their families was obviously at the forefront of my concerns following the RT programme. I'm very conscious of the impact this programme will have had on the residents, their families and the staff in the nursing homes featured in the broadcast. I'm also conscious of the impact the programme will have had on the nursing home sector more generally. It's important to acknowledge the committed, compassionate and dedicated providers and care staff operating in nursing homes across the country. Like everyone else watching the programme, I was shocked and deeply concerned at the level of non-compliance with care standards and evidence from distressing footage that was aired. I welcome confirmation referrals have been made to An Garda Síochána. I welcome that referrals have been made to An Garda Síochána. In a subsequent RT primetime programme broadcast on the 10th of June, we also heard personal testimony from Paul Guy on behalf of the family of Auden Guy regarding the poor ongoing care that their father had been receiving in Bennevin Manor. I know the feelings articulated by Paul struck a chord with everyone who has had a loved one in a nursing home. As Minister for Older People, as Minister of State with responsibility for older people, I want to state categorically that poor care, mistreatment, neglect and any other form of abuse of any person living in a long-term residential care centre is completely unacceptable. I expect the highest standards of care to be upheld by providers for every resident in every nursing home across the country, and anything less than this standard will simply not be tolerated. As the National Independent Regulator of Nursing Homes in Ireland, I expect HIQA and the Office of the Chief Inspector to utilise all powers available to them to ensure rigorous oversight and accountability in nursing home care. I and the Department of Health officials met with HIQA on the 4th of June to discuss the regular activity relating to nursing homes featured in the RT Investigates programme. At this meeting, HIQA Chief Inspector confirmed its continuous intensive engagement with the 2 nursing homes in question. On the 13th of June, HIQA furnished me with an interim report on their engagement with the 2 nursing homes over the past 2 weeks. The interim report details HIQA's inspections of these nursing homes since the RT Investigates was broadcast and their ongoing work in this regard. It also provides a brief overview of the MES Ireland Group. I and Minister Karen McNeill met with the Department of Health officials, met with HIQA yesterday the 17th to discuss this interim report. I wish to advise that the report has now been published and also furnished to the committee and is being considered along with a full report which is due from HIQA by the end of this week. It was published yesterday. Regarding the full report, I formally requested that HIQA furnish me with a comprehensive overview report of all the nursing homes in the MES Ireland Group, including an update position on the residents' Portlaoise and Bennevin Manor. It's critically important that residents of these nursing homes reside in a caring and safe environment. As I have already stated, I am expecting this full report from HIQA by the end of this week, providing a comprehensive overview of the regulatory history, including but not limited to regulatory compliance, escalating enforcement actions and any additional conditions of registration. HIQA has acknowledged in the interim report the importance of examining its process and methodology, essential that these are continually being looked at for ways to improve the inspection and regulation of nursing homes. I want to assure the members of the committee that I will continue to closely monitor developments regarding both nursing homes. The welfare of residents and their families will remain our highest priority. Last week, with the Department of Health officials, I had constructive engagement with representative bodies and stakeholders from the nursing home sector with an immediate focus on delivering the highest quality of care to the residents of nursing homes in Ireland. With Department of Health officials, I also met HSE senior staff and management of the 6 health regions last week. This engagement was constructive and centred on supporting residents and staff in the community nursing units across the country in delivering the highest quality care. I want to be clear that every nursing home resident deserves and should expect the highest standards of care at all times. To achieve this, it is imperative the registered providers of nursing homes adequately support their staff. Having effective governance and management arrangements in place ensures the staff are equipped to deliver person-centred care to residents. I want to advise members of the committee that the Department of Health officials, with the Department of Health officials, I met with the HSE Chief Social Worker, with HSE staff and management of the 2 health regions where the 2 nursing homes are located. The HSE have confirmed the directors and nursing from both HSE community support teams have been on site in both nursing homes and are continuing to engage with them. A review of safeguarding concerns that have been raised in relation to 2 nursing homes is ongoing. The HSE has also confirmed it will be engaged with all nursing homes in the AMIS group over the coming week. I will now turn to adult safeguarding. I am fully committed, along with Minister Carol McNeill, to strengthen existing safeguarding protections across the health and social care sector, and we will publish the first ever national adult safeguarding policy for the sector shortly. The policy will commit to developing adult safeguarding legislation for the sector, including nursing homes, and will build on the range of existing legislation, policies and procedures already in place in the sector for preventing, reporting and responding to abuse. The Government has included a health adequate safeguarding bill in its current legislative programme. Facilitate this to recognise that this will be an important further development in preventing and protecting vulnerable animals from abuse. I would also like to advise the committee of work that is ongoing with the Department of Health to develop a framework for safe nurse staffing and skill mix for long-term residential care settings for older people. This work has been overseen by a task force. A research team from UCC and UCD have undertaken substantial research and testing of a methodology for determining safe staffing in the sector. This work is near completion. I expect to receive recommendations for how this can be implemented shortly. To conclude, I want to firmly reiterate that poor care, mistreatment of any other form of abuse of any person living in a long-term residential care centre is wholly unacceptable and will not be tolerated. Every resident of a nursing home deserves dignity, respect and the highest standard of care. As Minister for Older People, I am absolutely committed to ensuring everything possible is done to ensure distressing scenes we witnessed in the recent RT investigation do not happen again in any nursing home across the country. I suppose, colleagues, we must work together to create the policies and legislation to further protect older people. They deserve the best of care. And when I was appointed as Minister for responding for older people, the teaching thoughts asked me to deliver a better future for older people. This is what I am determined to do. Thank you.
Thanks very much, Minister. So we'll now move to the members in rotation. I'll ask members to try to stick the time. It's going to be tight. I want to get as many members in as possible before we finish at 12 o'clock. So the first slot is for Fianna Fáil. Deputy Call.
Minister, I acknowledge your swift engagement with HICWA following the RT broadcast. I welcome the interim reports you have requested. However, these events have exposed long-standing weaknesses in both oversight and accountability, and I would like to ask the following 5 questions. 1. Independent oversight. Will the Government now commit to commissioning a full and independent audit of HICWA's effectiveness, governance and inspection procedures? 2. Audit safeguarding legislation. When will the Government bring forward adult safeguarding legislation as recommended by the Law Reform Commission? Will it include mandatory reporting of abuse and the legal recognition of care partners? Will it give safeguarding social workers a legal right of entry into private care facilities? 3. Systemic flaws. How will the Government respond to the structural issues that continue to allow poor care to persist? We cannot excuse abuse or neglect on the basis of staff shortages or the aftermath of COVID any longer. 4. Complaints and accountability. What actions will be taken to create a fit-for-purpose complaints mechanism for social care? At present, HICWA doesn't handle individual complaints. The Ombudsman won't examine clinical matters, and your service, your say, is limited to the HSE. Yet 81% of all the people in long-term care are in the private sector. How will the Government close this gap? 5. Privatisation and the future of social care. In light of these failures, is it time for a fundamental revaluation and how we deliver long-term care in Ireland? Will the Government consider a moratorium on further privatisation and instead begin building a system that prioritises public provision, transparency and dignity? Finally, I just want to say that our older citizens deserve care that is safe, dignified and human. The public are, as you're well aware, outraged. Their trust in oversight is broken, and only true accountability and reform will rebuild it. This committee must not shy away from the scale of that task. Today we need more than explanations. We need commitments, timelines and political will. And the political will to deliver a real change. The public is watching. And thank you.
Roughly how much time do I have in terms of it?
2.5 minutes.
Okay, that's just thanks very much, Deputy Cahill. So just going down to the point you raised, the independent oversight, HICWA were just in. HICWA are carrying out a review of their processes. They've acknowledged they need to be reviewed. In terms of, we'll say, doing further oversight, it's something we are considering in the department, and with Minister McNeill, we'll be making a recommendation to Government, to the Taoiseach and Tánaiste, and that's how we proceed with that. Adult safeguarding legislation, we're due to, Minister Kieran McNeill is due to bring to Cabinet, it's in the programme for Government, an adult safeguarding policy. Included in that will be the need and the requirement for legislation. That legislation is already in the legislative programme. I'd be looking that we'd expedite that. Looking at the systemic flaws, I suppose a couple of things that have come out. HICWA have now come back and made a recommendation around the regulation of groups. So a couple of points there. Number one, we need to regulate the parent. Number two, I think we have to bring changes whereby for any nursing home that changes hands in any form. So currently if a nursing home is a sole trader and it's bought by another person, that new person has to re-register. Currently if a nursing home is a limited company and it's just a change in the shareholding, they do not have to re-register. They have to inform the change. So I want that any nursing home in any form that changes hands, that be a way to by way of a purchase as a sole trader or purchase as a limited company, they must go to HICWA for re-registration. That should be an absolute. So that's something that HICWA have now brought forward on foot of the work they've done now. You also made reference to protecting the future. So I will have concerns around the growth in the groups area. So the department last January commissioned a body of work with the European Observatory Health and Systems, they're a European body, to look at the growth in the group structures in Ireland and the risks involved in terms of if they were to fail, but in terms of poor care as well. That report is due in September, and it's something we'll be looking at. But I think the critical thing that must be made as well,
Thanks.
We'll always have some private sector, so the standard of regulation is the key. That needs to, changes need to take place, and that's something we will be working on as a government.
Thanks very much, Minister, and just to welcome the school kids in the gallery as well. Next we've got Sinn Féin, Deputy Conlan.
Margaret, Minister. Minister, first of all, how many nursing homes are private? What percentage of the overall number of nursing homes are private?
The overall percentage is, so I'll give it to you both in number of centre.
Percentage, it's 1%.
Percentage, the numbers is just over 75% of nursing homes overall are private.
So under your watch, we've gone from, over the last 10 years, we've gone from 30% that were private to over nearly 80% that are private. So of the 10 prosecutions that HICWA sought last year in relation to nursing homes, how many of those were corporates, were private?
I don't have a figure on that.
Why not?
I can get
but
that.
This is, hang on a second, you're the Minister. We've had a scandal now in a number of nursing homes. There's a big focus on the lack of regulation. I'll get to that in a moment. I'll give you the answer to save you shifting through your pages there. It's 8 out of 10. So 8 out of the 10 prosecutions last year that were sought were in these corporates. So under your watch, what we've seen, Minister, with respect to you and your government, is a lot of these family-run nursing homes have been essentially run out of the market. We have these corporates that have come in, particularly this company that has now been the subject of a Primetime Investigates programme. HICWA have said that they do need new powers to deal with the corporate entities. You are on the record as saying that HICWA doesn't need any more powers. It does. That's obviously one of the areas. But in relation to the home in Dublin, and that's the First Care Benevan Manor home, do you know how many allegations of suspected or confirmed of abuse to a resident or were?
It's in the report.
Again, I'll save you the answer roughly through your papers. It's 198, Minister. Yes, but you should know these. 198.
Correct.
So 198 allegations were made. How much financial penalties was imposed on that nursing home or that nursing home group?
I don't know that. And that's a matter for HICWA.
No, it's not a matter for you. It's a matter for the government. We have a situation where I need to outline this to you from my perspective.
Yeah.
You have allowed a situation where we've drifted from a majority of nursing homes being publicly run to a majority of nursing homes being privately run. And even within that, what was called the mom and pop nursing homes, the family run nursing homes have been ran out of the market. These corporates are coming in, cutting costs, providing substandard care. We saw it outlined. One of them, in 1 year alone, over a number of years, 198 allegations of suspected or confirmed abuse of a resident.
Correct.
No financial penalties were imposed. Zero. Because why? Because HICWA doesn't have the power to do it. They told us earlier.
So I suppose that first point that you raised in terms of fines, the fines, HICWA can take any nursing home to the district court, and fines can be imposed by the district court.
No, I know that. I'm saying to you, Minister, that no fines have been imposed on this group. Zero.
Yeah.
Of all of those allegations, bear with me, sorry, Minister, bear with me. Zero, because HICWA doesn't have the power to do it. They've told us that, and they've told us that that's one of the areas that they would like reviewed.
Yeah.
Are you aware of the Emily case?
Yes.
Do you know what home that was? It was a nursing home. Do you know what year that was?
It was a good number of years ago.
Right. Are you aware of the Lees Cross?
2020.
Lees Cross. Do you know what year that was?
Over 20 years ago. 20.
Yes. The Brandon case in Donegal. The Grace case most recently. Yeah. And after all of those programmes, the Lees Cross going back 20 years ago, the need for adult safeguarding legislation was called for. So you come in here today and you say that, well, the Minister will bring a memo on policy. There is no legislation. Saying this in your programme for government, and we don't even have a heads of bill is not good enough. We don't have safeguarding legislation for adults. We've had all of these failures where adults in nursing homes, in disability centres and in a foster home have been badly let down. There is no mandatory reporting of neglect or abuse. There is no legal right of entry for social care teams. And despite me and others and experts in this field calling out your government for years, after every scandal, you're coming in here today and still no safeguarding legislation. So can you give us a date as to when that legislation will come before the Dáil?
Can I just clarify one point, and I will answer that straight away. On the fines, under the legislation, HICWA can bring nursing homes to the district court and they can impose fines. So it's not fair to say that there isn't a mechanism. There is. Do we need to look at direct fines?
There was no fines imposed on this group.
Correct.
After all of the abuse, after all of the neglect, families who feel let down, there was no fines. Zero.
That was a decision of HICWA.
No.
If we need to look at fines, we will.
They don't have the power to do it. Listen back to what they said.
It's not strictly. That's not strictly correct. On the second point, on the safeguarding, I would like to have seen that come before now. However, within the memo that will be going to government, it will be looking for a decision to bring forward safeguarding legislation as a matter of urgency. That means once there's approval, we will start drafting legislation.
Thanks.
You appreciate, Deputy Colonel.
Thanks, Minister.
This is a priority.
Minister,
we have to get it through. I can only operate. I'm in the role already a short period of time.
Sorry, that's time.
I'm in the role already a short period of time, and I've committed to getting this off the line.
That's time. Thanks very much. The next slide is for Fine Gael. Deputy Roach.
Thank you, Cathaoirleach. And can I say, firstly, Minister, most welcome that you have, I suppose, taken this by the scruff of the neck. And you know, we're all wiser. Hindsight is wonderful, you know, and the RTE Primetime Investigates has highlighted something that has now landed, if you like, on your desk. Most tragic and most unfortunate set of events. And I'm not going to go asking for dates, and I don't want to kind of, you know, expose anyone in any way, shape or form except those that need to be exposed, and those are the people that manage those care homes. And you know, as I said, you know, we're all wiser in hindsight. One of the things that came across to me as I watched, and I didn't watch it all, that we've all heard about, is the absolute unsuitability, if you like, of the people that were in those positions. and I referenced it earlier with the HICWA people that came here, is that sometimes people are employed for the sake of employment, but they're in hospitals and in care homes. The people that are employed, they have to have a degree of suitability for the position or the post that they're applying for. And what I witnessed were that those people were more suited to an abattoir rather than to care for the very people that we entrust to them to see their lives out. And there are some magnificent nursing homes right around the country, whether they be private, public or otherwise. There's some magnificent care being administered. And the task, I suppose, Minister, that you have now, given that it has now been exposed, is to ensure that the level of, I suppose, the process whereby those that want to work within the healthcare sector are suitable, and that the interviewing process are in some way, shape or other, that those people are not taking on a job for the sake of getting an income, that they're taking on a job because they want to work within that sector. And I think that it behoves us, and maybe yourself, Minister, to ensure that any nursing home or any care institution that requires staff, that there must be a criteria that that person must fulfil before they would be employed to do and to carry out the duties and the job of seeing people through to end of life. So I wish you well, Minister, with that. It's not an easy task, but at least now you're aware of the issues that need to be tackled head on.
Yeah, thank you very much, Deputy Roach. A couple of points. In terms of safe staffing mix and qualifications for staff, that's currently being looked at by task force. We expect to receive that report very shortly, and it's something we'll act on as a government. I suppose just a couple of points really. Safeguarding is an absolute priority, but it shouldn't be overlooked that there are safeguarding regulations in place through the HSE and through HICWA in terms of their regulations, in terms of abuse of people in nursing homes, notwithstanding the fact that we must bring in legislation to strengthen that. Secondly, I met HICWA on the 4th of June and I asked them two direct questions. I didn't get a chance to in terms of time limitations with Deputy Colonel. Did they have sufficient powers and did they have sufficient resources? On both occasions they said yes. I'm glad that based on the foot of the work they've done in the last 2 weeks, that they've now highlighted other areas that require changes around parent groups, around that area of regulation, and that's something that we want to act on properly. Another thing that I've asked HICWA to do, and a practical measure, is that at the moment when they issue reports, they're historic. They only report on what happened on the day. So they might report 2 or 3 months after the inspection. I want them now to report with an updated position in respect to that nursing home. People who are putting loved ones into nursing home, or people going in there themselves, they are entitled to know what the up-to-date position is on a nursing home. Currently, they don't get that from the HICWA inspection reports. So I've asked HICWA to bring that immediate change. Furthermore, we know in respect to one of the nursing homes, the issue was in terms of new staff coming in. They should be required to advise HICWA where there's a change in staff. I've asked HICWA to bring those in. They're measures they can bring in without any need for legislative change.
Minister. Next slide is for Labour Party, Deputy Sherlock.
Yeah, thanks, Chair. Thanks, Minister, and to your officials for coming in today. Minister, I suppose, to pick up on the registration of nursing homes piece, right? And I think that's probably, there's so much to be aghast at in this interim report that we received last night. But that a company can come in and buy a nursing home and effectively piggyback on the good work of the previous owners and not have to register with HICWA. How has that been allowed to happen? Like, if I want to set up a preschool in the morning with 10 or 15 children, I have to go through all sorts of hoops with TUSLA. How have we allowed a situation, how has this government allowed a situation where companies are able to buy up nursing homes and not register with HICWA at the point of purchase?
So, the government provide a policy to allow independent regulatory bodies like HICWA to function. HICWA did not request that specific measure up to the interim report formally now. So what happened historically is most nursing homes were probably family owned. They were probably operating as sole traders. And if they sold the business, then you had to re-register. A situation then arose whereby with companies that you could purchase a company. If there was a change, and you just purchase a shareholding, if there's a change in the directors, they're required to notify HICWA of the change of directors, but it doesn't require re-registration. That's something we have to change.
It's a policy of facilitating big companies
Secondly, so I think in all situations, and this is something that I want that we move, and Mr. Kieran O'Donnell will be bringing a memo to government very shortly on all these areas in terms of what the change we can bring in terms of the operation of the relationship of nursing homes by HICWA. And HICWA have acknowledged in the report and in their deliberations with the committee here today that changes need to be made. So that particular in terms of the groups, that's a change we will be making.
So when HICWA, when a nursing home does have to register now every 3 years, right?
Yes.
My understanding is they don't have to provide financial information. And to my mind, HICWA are currently registering nursing homes that are potentially insolvent or going to be insolvent into the future, and then the HSE has to step in. So how many nursing homes has the HSE taken over last year and this year? And what is your view, Minister, with regards to the lack of review of the financial situation of a nursing home? Because clearly that is contributing to some of the issues, the profiteering and also the fair deal situation or negotiations in terms of the financial viability of some nursing homes across this country.
So last year, so as you're aware in terms of providing security for nursing home residents, if a nursing home provider fails, then the state steps in through the HSE to continue that nursing home. So we took over 5 nursing homes in the last year. They were all through 6 actually. 3 from APRI, then there was a Bushfield Care Centre, Ferna Manor Nursing Home and Lucan Lodge. The APRI ones are APRI Living Ballinasloe, APRI Living Galway and APRI Living Camp. And I would expect that when HICWA are doing their inspections, it's an area that will cover, but it's something I will go back with in HICWA, and it's something that, in terms of the regulatory process, we must look at. So for me, it's all about politics aside, it's all about the care of the older person. We need to take a very much a look now, and that's why I suppose when the programme, when RT broadcast on the morning of the programme, the nursing homes they were covering, I immediately started meeting with HICWA to get this body of work done. They're to come back with a further body of work at the end of this week in terms of the overall MES group, and these are matters that I take very seriously, and we will be proactively, I suppose, as a matter of priority and urgency, bringing forward changes. 2
final questions. Are you satisfied that, with the current inspection regime within HICWA? Do you believe that there's enough inspectors there? Are you aware of high turnover issues with regards to the number of inspectors that they do have? And then thirdly, there's a report sitting in the department since 2022 making very clear recommendations with regards to
that last point.
There's a report sitting, and I raised it last week in the Dáil report, the report on strategic workforce advisory group on home carers and nursing home healthcare assistants on pay and collective bargaining for workers within the sector, some very low paid workers. What have you done as Minister to ensure that those recommendations are implemented? Sitting there 3 years now, and to my mind, nothing has been done.
Just a very brief response, Minister.
So, very quickly, in terms of HICWA, I've said if they require additional resources to let us know. They have got additional inspectors. They're up at 43 now. I'm not aware in terms of the issue you raised in terms of turnover on the strategic workforce. It's something I have engaged with the officials, and it's something I am prioritising.
With the trade unions, have you met with the trade unions?
I met with the trade unions, but it's something that I'm very much open to meeting with trade unions.
The trade unions, okay.
Thanks very much. For the next round, we'll have to go slightly tighter, and we'll only get to each of the groups once before the meeting closes. So the next, I've got a slot for Fianna Fáil, if you want to take it. Senator Costello?
Yeah. first thing I want to ask is around when HICWA are inspecting a nursing home about the right to entry. Like, do you agree that like they should have to notify nursing homes? They said that they mentioned the right to entry. So like, are you satisfied that, like, you know, should they be going to nursing homes in the middle of the night and stuff just as standard? Have they discussed with you any other nursing homes that concerns have been raised about also? And what are you doing about that? Maybe I'll share time with my colleagues if this is the last time we can speak.
I suppose, Minister, thank you for coming in here today. This is extremely serious. The public do expect answers and accountability. HICWA were here this morning. We were delighted to meet them. But, you know, there were certain things. Under the existing framework, the idea that there were not enough gloves and continence wear sheets and towels in a nursing home, I mean, these are countable items. That's not a relation to culture. That is something that should be, under the current regime, inspectable. The staffing levels are really important. That conversation is going on with the Department of Health and HICWA about staffing levels. That's going to be extremely important. Individual complaints, we need to be able to facilitate that. And I have to say, I must reiterate too, that there should be the ability for HICWA to directly fine corporates that do not keep, that they should not have to go into the courts. There should be a financial penalty. And finally, because I don't want to hog the time here, there are other people who need to talk. On the private versus public, I did come in here with the preconceived idea that this was only corporate. I have my own concerns about the increasing congregation of people in nursing homes run by corporates, but HICWA did reflect today that there was a considerable number of public nursing homes that were under restriction also. I'll leave it at that. You might reflect on that. Sorry.
If I might do it in reverse order, is that okay, Senator Costello? Just so staffing levels I've covered, and there's a task force report due to come to us straight away. In terms of individual complaints, there's measures to be brought in whereby for where it leads to death or serious injury, that HICWA will be able to do investigations. That's something we very much want to expedite. You made in terms of the fines. It wasn't a recommendation that HICWA have ever made to the Department of Health or in the report. However, I'm very open to looking at that fines issue directly for HICWA. It's something very on the nursing homes. The programme for government commits to increase the number of public nursing home beds, and that's something I feel very strongly about. There's 615 beds, public nursing home beds, being refurbished or new this year. We've a capacity review currently underway in the Department of Health on the whole area of public nursing homes. I want to really to bring forward a proposal which very much expedites the rollout of public nursing home beds. Regulation is across the board, whereas private, public or voluntary. The regulation should apply in the exact same way. In terms of going back to Senator Costello, HICWA, 85% of their inspections are unannounced, right? I wasn't aware that they had to in any way make the nursing homes aware they were arriving. They should have right of entry. The rest are announced, right? You asked me about, am I aware of any issues with other nursing homes? It was brought to my attention by the officials on Monday. There was 2 nursing homes where there was notifiable incidents. One of them involves An Garda Síochána. The other is, there are 2 very serious issues. We have followed up with the HSE safeguarding team to be involved, and furthermore, my officials continue to engage with HICWA on the particular matter.
Just in relation to the remaining time, so we only have 15 minutes left, so we're doing 4-minute slots for the final slots, going back to each of the groups at once. So if members do wish to share that slot, as Fianna Fáil did in that case, it's open to them.
Aware of that, I'm same across the way, we're unaware of that.
Well, we can only get back to each group once more. We were finishing at 12, Deputy. We can't fit everybody. Like,
I think we should be aware of just being able to share the time more equitably amongst ourselves.
So the next slot is for Sinn Féin, Deputy Clerk.
Thanks, Chair. Minister, with a view on the clock, I'll keep my questions very pointed. You've spoke of urgency, expediting and commitment to an adult safeguarding bill, but you haven't given any definitive timeline for that. And I must put it to you, Minister, that in the absence of that legislation, serious safeguarding issues are being dismissed, science issues, which is not reflective of what is happening in our nursing homes. But in terms of government's commitment to, at some point in the future, introducing this bill, do you envisage that bill containing criminal offences for institutional neglect and reckless engagement of those who are living in nursing homes? And secondly, in terms of future provision of beds, will the state commit to a conditional enforcement of care standards and transparent ownership when it comes to the use of private beds? And finally, a comment, your opening statement says that the HSE has confirmed that it will be engaging with all nursing homes within the EMIS group in the coming weeks. The HICWA have confirmed to us that there are 95 nursing homes under some level of restriction, but only 40 odd of them are actually privately owned. And my colleague, Senator Ryan, has a query.
Yeah, please. Yeah.
Thank you. Minister, we have history repeating itself here from the last cross scandal, which actually led to HICWA being established. We're here 20 years later, and we're sitting here now having the same conversations, and HICWA is in place. My one question that I have is, has the department ever withheld or redirected funding in response to repeated governance failures or quality of care?
So, can I take Senator Ryan's points first? Senator Ryan, just like, sorry, there. Yeah, that's the second. So, just to deal with the point you raised, right? Are you speaking about specific funding to nursing homes?
I'm just speaking in terms of any of the nursing homes that have ever come up with issues. Has the government?
Obviously, HICWA are the independent regulator. If HICWA have a number of tools, one of them is where they put a restriction on the number of, so they put a restriction on that they cannot take any more patients. That's one. Two, the second measure is where they can, we'll say, deregister someone, and then, in that case, the funding ceases. So,
okay, so there has been that. That has been happening.
Absolutely, absolutely. Okay. In terms of Deputy Clerk, and I want to bring forward a safeguarding legislation as quickly as possible. To do that, we have in the Pro-Vote committed to bring forward a safeguarding policy. Within that, there will be government to give the approval to proceed with the legislation on safeguarding. I want to bring that forward as quickly as possible with Minister Karen McNeill, and I'll work with cross-party on that. On the issue in terms of the safeguarding legislation, the Law Reform Commission did a very good body of work, and you referenced some of what they have in there. We'll be considering all aspects in terms of what should be in the safeguarding legislation itself. However, I think it's worth noting that at the moment, and we've seen it, where issues have been referred by HICWA to An Garda Síochána along with the owners of nursing homes. So there is, we'll say, the tools there at the moment to refer to An Garda Síochána.
Just on that issue, Minister, HICWA have said that the event is referred to An Garda Síochána, but where a staff member is operating with limited supplies because of the management, because of the directors, it's my firmly held belief that those directors should be held responsible for not supplying an adequate level of incontinence pads, sheets, for a service that the state are paying healthily for.
It's unforgivable that there wasn't adequate supplies in those nursing homes. Unforgivable. Neglect.
Will you make it an offence in legislation?
We'll consider everything in the round in terms of the safeguarding itself. And for me, it's about, once again, at all times improving the lives of people in nursing homes, and more particularly to make them safe.
Thank you very much, Minister. Next, we turn to Fine Gael.
Thank you very much, Minister, and thank you for being available here this morning to deal with these issues. As you're aware, Minister, and I outlined recently about my own involvement in nursing homes come back to 2004. As a result of legal action, the Department of Health ended up having to pay out over 450 million back to 20,000 families. Where I'm concerned about now, Minister, is that 40% of the funding currently provided for nursing homes is going to 20% of nursing homes, which is the public nursing homes. So 40% of the funding, 20% of nursing homes. 60% of the funding is being used to care for 80% of the private patients in private nursing homes. The gap is 1,926 for public nursing home is the cost per week per bed. The cost per week in a private nursing home is 1,250. So there's a huge gap. The issue that I want to raise, Minister, and it's about this gap, about the issue, Minister, is the issue I want to raise is where there is no limitation on the number of nursing homes one group can have. We have a situation in business where there are certain businesses where you cannot acquire a competitor. There are rules and regulations on it. Is it now not time to bring in a similar regulation in relation to nursing home management? For instance, if the nursing home we were talking about now, which I think has something like 25 nursing homes, if they decided in the morning to walk away and say, we're closing down all 25 nursing homes, is the department and the HSE, would it be able to deal with that issue? And I'm really concerned about it now because of this issue that has arisen. The standard was appalling, the way people were treated was appalling, but we have a responsibility as well of looking to the future about how we deal with this challenge, because it's not beyond the bounds of possibilities that this could happen, and the department need to be aware of it, because to the issue I go back to which I raised earlier about 2024 or 2004, the department were aware of it for over 20 years and took no action. We're now aware of this challenge. I'm asking, is the department prepared to look at this and bring in the necessary regulation to restrict the number of the percentage of patients it is going to care for? And I really think this is an extremely important issue.
Thanks very much, Deputy Burke. And the point you raise is something that the department are very conscious of. I am myself. So, as I said earlier, the Department of Health commissioned a report with the European Observatory, the Health, their group, to specifically look at last January. But if you look at the growth of groups in Ireland in delivery of nursing homes, the risk that poses both in terms of financial and they're failing, and in terms of care. That report is due to come to us in September. And these are matters that we will consider very much. What we want here is a model that is safe, sustainable, fair, more particularly, it's all about the care of the older person. So it's something that in the department, I as Minister for Older People and Minister Kieran O'Donnell, we're very aware of, and we're doing a body of work around that area.
Minister, one of the issues in relation to private nursing homes as well, for instance, all the private nursing homes are paying commercial rates to local authorities. The public nursing homes aren't required to do that. Likewise, they're also paying insurance, which is an additional expense. Yet, there's a gap of €700 per bed per week between what a public nursing home is getting and what a private nursing home is getting. Yet, the private nursing home has all these additional expenses. And I really think that this issue needs to be reviewed, because one of these organisations is going to walk, and we're going to be left,
So two things on that. The Department of Health and the HSE have a productivity and savings task force, which is looking at that particular point in terms of savings in terms of public nursing home beds. But the whole issue is about, we need obviously a mix. I want to very much promote and expedite the issue of the provision of public nursing home beds, but we must have a sustainable model in the private, and you have a lot of family-run nursing homes out there. I think this is a very important point to put out as well.
Thanks, Minister.
The greater majority of nursing homes provide a great level of care and they have dedicated staff.
Cheers, thanks, Minister.
And that's something really that, in my view, is hugely important to state as well.
Thanks very much, Minister. We just have 2 slots left, so there's myself and Social Democrats, and then we'll get back to another Fianna Fáil speaker if somebody does want to get back in. If you want to maybe alert Deputy O'Sullivan is still around, Minister, come back in. Minister, I just want to pick up some there on the model of the nursing homes. So am I right in thinking that in the early 1990s, about 30% for profit, and that's now increased to 80%. And in the meantime, small operators closed, or community-based nursing homes have closed, some independent nursing homes have closed, and that the international research shows that you get poorer outcomes in private nursing homes compared to the not-for-profit and community sector. Is that also your understanding?
Well, I'd like to see that research you've provided. For me, we have an empirical body of work ongoing in the Department of Health with the European Observatory in Health to specifically look at the growth of groups and what you speak about, that large increase in their delivery in terms of healthcare. Once again, we have to, that sector is regulated as well, and there are good nursing homes there as well. But once again, for me, as I've come into the role now, I want to do a real detailed body of work in terms of looking at the sector and seeing that we have a sustainable sector and the implications in terms of the growth in the groups.
So you're agnostic as to the better outcomes in the different...
First of all, I think it comes down to individual nursing home, and HICWA are regulating across the sector, whether that's in the public, the private or the voluntary sector. I think it's about that individual nursing home. That research work that you have, if you might provide it to me, I'd welcome that.
I suppose then, Minister, moving on to safeguarding. So you mentioned that the HSE has a safeguarding policy.
Yes.
But that doesn't apply to private nursing homes, is that correct?
The safeguarding policy is that you can refer in terms of safeguarding. They do not have a legal right of entry, but in terms of the regulation for safeguarding, that is there.
So in practice, we're saying 80% of the nursing homes are private, but the policy and the right to entry doesn't apply.
But invariably, nursing homes, in virtually all cases, will allow the HSE to enter, and that's something that is there. But once again, and I'm not in any way notwithstanding, we still need the legislation, and that's why I want to bring it forward as a matter of urgency.
I suppose where I've moved to, Mr. I'm a new TD, but I've worked in the Houses for a number of years, and I was involved in adult safeguarding legislation that came through the Shannon in 2017, so 8 years ago. Private Members Bill, quite a substantial Private Members Bill published. Law Reform Commission done work. And what I'd like to know from you and also from the department is, like, why has this taken so long? Like, we had a substantial cross-party support for that Private Members Bill in 2017, widespread agreement that it was needed, but 8 years later we're still talking about heads of bill drafting. Like, why this serious delay?
Work has been done in terms of the regulations by both we'll say legislation by both HICWA and the Mental Health Commission in terms of safeguarding in nursing homes. Also, you had the National Safeguarding Office has been set up in the HSE, and they've put teams in there on a practical level. They're there. For me, it's in the program for government, and I can only operate in terms of the role I'm in now, is to look at what's in the program for government. It's there to bring forward a safeguarding policy to Cabinet, which Minister Kieran O'Donnell will do very shortly. That is then look for a decision on the legislation. We'll expedite the legislation. I can only work with what's in front of me, but I'm giving the commitment that this will be expedited as quickly as possible.
And then finally, Minister, you talked earlier about HICWA were saying their ultimate sanction is closing of a nursing home, and then after the HSE will take it over. Do you think there should be sanctions beyond that, like fines? Also, are those nursing home providers then able to set up new nursing homes? Is there any rules or regulations to say that they can't do that? Just very briefly.
So, once again, the fines issue, I came up in the committee hearing today, which I heard for the first time. They are available tools where HICWA can go to the district court, and there will be fines potentially up to €70,000 along with prison sentences. In terms of the measures that they have, one is the ultimate is to close. They have measures in terms of restrictive conditions to stop the nursing home taking any further admissions, which they've done with the MS group in its entirety now. And furthermore, they have compliance notices which are there as well. In terms of the wider issue you raised, that's something I'd like to go back on.
So we time to use one more slot, and next on our rota is Finn Fall. Somebody wants to take the time.
So I'm going to come in really quickly. First of all, today I think it was very disappointing, the lack of time that we had with HICWA and with the Minister. We all needed with an awful lot more to say. The nursing home was being paid for a service that they didn't follow through on. Will you guys be seeking reimbursement from the nursing home given that they didn't provide the service? And I'm also interested into what reports are you in receipt of from nursing homes to ensure that the staffing levels are, at an acceptable level, because it came up on several occasions that these nursing homes were understaffed. So if they're understaffed, it's quite obvious they they just aren't providing the sufficient service. So I'm interested to see if you're in receipt of, or has the amount of reports you're going to be receiving to ensure that service levels do stay at an acceptable standard, have they increased? Michael.
Thank you, Minister. Just look, again, the scandal has left many of us shaken, and since the Prime Time Investigates programme, constituents are now coming and they're asking increasingly about home care, even though they know that they won't be able to even manage. And we have, I just want to emphasise, we have great nursing homes in my own county. I was on the board of management for St Joseph's Home in Cloughlin for years. I've worked closely with the community hospital in Village Island and Carsween, Dingle and Kinmare. Can I ask, have you actually met, since this scandal broke, have you met representatives of the company involved?
Yeah.
And again, I've raised this a couple of times at this health committee. I think it's important that we bring them in here. Thank you, Chair.
So just to take in, if you bear with me, Deputy Cahill, no, I haven't met the MS Group. It wouldn't be appropriate. HICWA are carrying out inspections and investigations of the group. We need to let them do their work. It's important. I don't want to in any way interfere in that process. There's a body of work on with the MS Group, and that's something that I take very seriously. Senator Costello, you made reference to the funding, and all the nursing homes in the MS Group at the moment have a restrictive condition in place now where they cannot increase their numbers. And in fact, if people leave those nursing homes, they still can't. So let's say it was a figure. They cannot keep the figure at that level. If people are leaving, the number just goes down. And I suppose the broader question in terms of funding, that's a matter for HICWA. And these are something in terms of our overall review of the inspection regime and the regulatory regime that HICWA operate under. I want to consider everything to improve the process at the moment, always with the aim to improve the quality of healthcare, a safe environment for older people in nursing homes. That's my primary concern.
If they're not providing service and basic needs for the residents, they shouldn't be getting paid. Like they should be refunding the money. Like there has to be some kind of a penalty in place if incontinence pads can't even be purchased.
There would be nothing to stop HICWA taking them to the district court and imposing fines and whatever is required in terms of the district court. But the wider question in terms of HICWA itself being able to impose fines, that's something we look at. We need to bring in an enhanced inspection regime to ensure that we have a safe environment for residents, that any complaints that arise, that they're dealt with immediately. And that's why I want to have the reporting process by HICWA in terms of when inspection reports go up online, and people now rely on those, that they not only provide what happened at the date of the inspection, but they give an update as to everything that's happened since.
Thank you, Minister. Thanks very much. Just in relation to the piece on time, so we have a 2.5-hour slot. We have followed through the rota as agreed. We want to allocate equal time to each group on that rota to ensure that every member can get in and ask as many questions. But we're limited by the slot that we're provided, which is a 2.5-hour slot. It is open to us as a committee to re-engage with HICWA. As we've said to them this morning, we may invite them back in for another engagement, and equally, Minister, we may engage again on this issue, because I know members have more questions. But hopefully that I understand that we moved through the rota in the agreed way and provided time adequately and fairly to each group as was agreed.
Can I thank the committee?
Yeah.
Look forward to any further engagement. It's all about a common purpose in very much having safe nursing homes for our elderly. That's the absolute objective, and I'm determined that we get to that. That's something we will continue to work on.
Thank you, Minister, for your time this morning and for your officials on this important matter. And no doubt we will engage again. The meeting is now adjourned until tomorrow morning, 19th of June at 9:30 in Committee Room 1. So we're meeting in a different committee room when the committee will meet with Children's Health Ireland, the HSE and the Department of Health to consider the treatment of children with hip dysplasia, scoliosis and related matters. Gormagat.